So we'll be talking of ciliary ganglia. So ciliary ganglia is one of the peripheral parasympathetic ganglion. It's basically the pinhead sized ganglia which is topographically connected to the nasociliary nerve. This nasociliary nerve is a branch of ophthalmic, which is itself a branch of fifth nerve, that is trigeminal, but functionally this ganglia is connected to the oculomotor nerve, which is your third nerve, right? And this ganglia is tiny in structure with the size of pinhead. This ganglia is situated at the apex of the orbit, that is between the optic nerve on one side and the origin of lateral rectus muscle on the other side. So basically it is sandwiched between two structures, optic nerve and the lateral rectus muscle. Now this ciliary ganglia, as all other ganglias, has got three roots. One is the parasympathetic root, other one is the sympathetic root, and third one is the sensory root. So it has got three roots: parasympathetic, sympathetic and the sensory. So we'll be talking of all these roots one by one. So first of all we will take the parasympathetic root. So the parasympathetic root is derived from the Edinger-Westphal nucleus, which is located in the medulla and which is located in the midbrain. It is lying in the midbrain, Edinger-Westphal nucleus. The fiber starts from here. It passes through the nerve, which is your third nerve, that is oculomotor nerve. Then this fiber enters into the branch which is supplying the inferior oblique muscle. So the nerve which supplies the inferior oblique muscle is fiber, which is parasympathetic fiber, will pass through this nerve over here. Then finally this nerve is going to relay in this ciliary ganglia. So the fibers which are behind the ciliary ganglia, we will call it as preganglionic fibers, right? So they will relay in the ciliary ganglia. Postganglionic fibers will start from this ciliary ganglia and reach towards the eyeball, supplying two muscles over there, that is constrictor pupillae and ciliaris muscle. So while supplying, they will form a network of nerves over here, 8 to 10 networks, that is short ciliary nerves. So we'll call it as short ciliary nerves. So these fibers, which are short ciliary nerves, are the postganglionic fibers. So parasympathetic, starting from Edinger-Westphal nucleus, via oculomotor nerve, then via nerve to inferior oblique, relay in the ciliary ganglia, via short ciliary nerve, supply two muscles, constrictor pupillae and the ciliaris muscle. Now talking of the sympathetic root. Sympathetic root starts from the T1 spinal nerve, which is basically the lateral horn of T1 spinal nerve. This fiber will go upwards into the superior cervical ganglia, which is in the neck region. So it will go over there, relay over there, and the postganglionic fibers will start from the superior cervical ganglia. This fiber will form a plexus around your internal carotid artery and will pass through the ciliary ganglia without relaying. So no relay is going to occur in the ciliary ganglia because the relay has already occurred in the superior cervical ganglia. So the fibers will pass without interruption, then coming out of the ciliary ganglia in the form of short ciliary nerves, supplying the dilator pupillae muscle. So this is the sympathetic pathway. Now lastly, talking of the sensory root. So sensory root, the fibers are going to start from the short ciliary nerves from the eyeball, pass through the short ciliary nerves. It will also go through the ciliary ganglia without interruption. So no relay is going to occur over here. Without relaying, it will pass, and via nasociliary nerve it will go into the higher center, that is trigeminal ganglia. So this is the ciliary sensory root. Thank you so